It's probably fair to say that the new COVID-19 variant called Omicron is an entirely unwelcome arrival this holiday season. It's tangled borders, changed many people's plans for seeing long-missed friends and family, and it's highlighted some unsightly inequities on the global vaccine front. With us now on how to navigate this new variant, in Marshfield, Wisconsin, Maria Sundaram, epidemiologist and associate research scientist at the Marshfield Clinic Research Institute. And in Hamilton, Ontario, Dr. Zane Chagla, infectious disease physician at St. Joseph's Healthcare Hamilton and associate professor of medicine at McMaster University. Welcome back to you both.
Thank you.
Thanks for having us.
So I think a lot of us are just kind of, I don't know, frustration is the word, but a new variant is not something, we knew it could happen, but it's not something a lot of us anticipated, especially this time of the year. So Maria, I wanted to start with you. COVID-19 Omicron variant has been identified in Ontario, Alberta, and British Columbia. What do we know so far about how transmissible and how severe it is?
We have very limited information right now, but the information we do have suggests that it's incredibly transmissible. We know that it's outcompeting the Delta variant in South Africa, and we really expect that to be the case wherever it sort of takes hold next, and that includes Ontario as well.
And Dr. Chagla, this is not a new thing. We've had new variants before. What do we know about the Omicron variant?
Yeah, I mean, the evolution is very different other variants. We have seen 5 to 10 mutations for the variants of concerns we dealt with, but we're seeing 32 mutations here. And, some of those are concerning for immune escape more than anything else. And certainly the pattern we've been seeing in some countries is people being infected regardless of their vaccine status. And so, this creates a new susceptible population. As this starts spreading, it's not simple as saying vaccinated is going to prevent all infections. It really could bring, vaccinated people as transmitters back into the cycle, not necessarily the people that are getting the sickest, but could bring outbreaks and other things back to the forefront again.
Kids under 11 can now be vaccinated. And I think for people who are hearing what you're saying, there's another level of concern in the sense that, Omicron variant was identified in Southern Africa, but then we found out later that it was already spreading in Western Europe before South Africa identified it. And in response, different countries have enacted these travel restrictions. And Canada, to address Omicron variant, this is what our country has done. For travelers who have been in the following countries within 14 days prior to arrival in Canada, these are the countries: Botswana, Egypt, Eswatini, Lesotho, Malawi, Mozambique, Namibia, Nigeria, South Africa, Zimbabwe. The following applies. Foreign nationals are not permitted entry into Canada. Canadian citizens, permanent residents, people with status under the Indian Act are subject to enhanced pre-entry and arrival testing, screening, and quarantine measures. Travelers, both vaccinated and not vaccinated, arriving by air are required to stay at a designated quarantine facility while they await their arrival test result. Dr. Chagla, Canada has increased its travel restrictions to ban travelers from 10 African countries. Is this an effective way to combat the Omicron variant?
Look, if we knew exactly the moment this arrived, the region this arrived, maybe. But the reality of the situation is Southern Africa and South Africa particularly described this variant for the first time. They were not the source of this variant. And again, these travel bans really encompass the countries where it was first described. But we are learning more that Western Europe, the United Kingdom, has likely had community transmission for some time. So I don't think these travel bans blankly are actually hitting the target. Certainly enhanced testing after travel, a short quarantine period, measures at our border to treat all travelers universally as a risk are probably reasonable. But we are very likely to see Omicron cases come in through Western Europe, through the United Kingdom, through the United States. And what we're doing is creating an inequitable barrier to Southern Africa, Nigeria, and Egypt, while allowing these countries to have free access to Canada and infect our population. So, it's inequitable. It sends a terrible message to the world for the people that describe this variant, that they're facing economic hardships, their expats face hardships. There's political instability. But B, again, we're not actually doing what we should be doing in terms of reducing the risk of transmission in our setting if we ignore other countries.
Maria, Dr. Chegla brought up a really important point. He says this sends a terrible message to the countries that identified, in this situation, Southern Africa identified Omicron. Do you worry as a scientist that, some countries might be watching what's happening and think, what is the point of saying we have a new variant if the repercussions for this country is much greater than what other countries face?
Yeah, I mean, it's clearly a disincentive, which is really unfortunate, especially because it's very likely that Omicron was not originally existing in South Africa. It's just identified in Southern Africa, right? So when we institute these travel restrictions, we have to ask ourselves, what's the point? If the point is to slow the spread of Omicron, we have to be implementing this travel restriction across all of the countries that have Omicron. But we also see that there's community level transmission of Omicron in Canada right now. So, we really need to be asking ourselves, what's the best way to do this? And for me, the best way to do that is improved testing, improved availability of rapid antigen tests and other tests, and the availability of boosters as well.
Well, when we talk about the rules that we have around testing and the people who are coming into the country, earlier this week, the Auditor General, Karen Hogan, called out what she called the significant gaps in the Public Health Agency of Canada's administration of border control measures. Why are we seeing these gaps in terms of travel policies, Dr. Chegla?
Yeah, look, it's a human system, right? And the human resources to make these systems work are not necessarily there. To be able to police every traveler, make sure every test is followed up on every traveler. A lot of these are third-party contracts with companies doing the testing. There's a lot of holes in the Swiss cheese that can go wrong and lead to spread. And we've seen, obviously, the Alpha variant spread in Canada, the Delta variant spread in Canada. And so, again, these processes are faced with human error. We also know that hotel quarantines can be a source of infection. And we know, a case in Hong Kong where the Omicron variant went from someone from Southern Africa to someone that hadn't traveled to Southern Africa because their rooms were across from each other. So, all these processes have faults, and again, a rational process to test, to make sure aggressive testing is done, and using public health measures in those contexts probably pays more dividends than creating rules and guidelines that have loopholes that can be worked through and where human error can be introduced.
The Canadian-American border recently opened. And Maria, according to a survey conducted by Leisure and the Canadian Association for Canadian Studies, most Canadians are actually in favor of the stronger travel restrictions that we're seeing right now to combat Omicron. Being a dual citizen living in the United States, what are your thoughts?
I'm all for any sort of intervention that prevents the spread of Omicron in the U.S. or in Canada or across that Canada-U.S. border. I'm not convinced right now that a border closure is going to be the most effective way to do that. I think what we really need are a lot of, as Dr. Chegla said, a lot of different slices of Swiss cheese so that we can protect ourselves as much as possible. A border closure kind of gives us this false sense of security, when in reality, I really think we should be focusing on testing, follow up very closely with people that are entering the country, and providing people the opportunities both to get tested, to wear high quality masks, and again, to be boosted if they haven't gotten a booster yet.
I want to go back to that survey. 65% of Canadians think the Canada US border should be closed for a period of time due to the Omicron variant. Maria, you mentioned testing and tracing and masks being the solutions to address what's happening right now. But if travel bans aren't the effective solution, what do you think Canada could do instead to prevent the spread of Omicron? Dr. Chagla.
Yeah, look, we're going to have to live with our borders being open at some point or another, and that point is going to be where variants emerge, and we are, in tuned with our global partners in terms of the evolution of this virus. So, I think certainly enhanced testing is not unreasonable. A short period of quarantine until enhanced testing is complete, but we have to look at the long-term picture here. And, again, being susceptible to changes in the world on a moment's notice when a virus evolves means we have to provide the tools for the world to deal with this virus. And that really encompasses transfers of technology, transfers of medical services, and most importantly, vaccine equity.
Well, vaccine equity is something that we've been hearing a lot. And I think someone at the WHO, the UN, called it vaccine apartheid. Maria, 80% of eligible Ontarians have been fully vaccinated, while only 1 in 15 people in African nations have been fully vaccinated. How does vaccine inequality factor into the spread of Omicron?
I think it's pretty much the cause of Omicron as far as I'm concerned, right? So the longer we allow populations to be completely unprotected, the longer we put ourselves at risk of additional variants of concern like Omicron. So, we either can be planning for more equitable access of vaccines, or we need to plan what we're going to do when we're out of Greek letters.
Dr. Chugga, you've been talking about this a lot on Twitter, and I think people are very scared and worried about what's happening. And at the beginning of the pandemic, we kept hearing there was this debate. We should be listening to the people that we've elected and not the scientists. And now the science this time around, if you are living in a country where you can't even access a vaccine, and then we're in a country where we're being encouraged to get our third dose of the vaccine. What does the science say about this?
Yeah, look, I mean, I think we're learning that the neutralizing antibody levels, our first layer of response to Omicron, are reduced, and a third dose may support better neutralization and better outcomes. It's not perfect, and so certainly people that are eligible for a booster, those who have medical conditions, who are over a certain age, who are at high risk of infecting people in those two groups, they should probably be getting their booster. But I think, again, the evolution of this virus is not going to be kept in check if we keep revaccinating our own populations. We really do need to think about what strategic groups we boost and what strategic groups and what strategic outcomes we want from a global vaccine standpoint. And that involves transfer of vaccines through donations, but also tech transfers and supporting local innovation in vaccine development.
In this province, while we have a good chunk of people who have been vaccinated, we still have a lot of people who haven't been vaccinated. And Dr. Chagla, you've been vocal about how developed countries, including Canada, have been contributing to vaccine inequality. How have we been doing that?
Yeah, we've taken a lot, right? Like we have stockpiles of vaccines. When we started our booster campaign, there were 14 million dosers in freezes. And those were given out as boosters, but at the same time, we shouldn't have 14 million doses in our freezers, especially as we don't produce any doses in Canada. And so those doses are ones that COVAX could fulfill, that countries with contracts with Pfizer and Moderna could fulfill. But instead, they're sitting in a freezer in our country. And so we're just as liable for what's going on in this world. We're making major changes to deal with Omicron. And we have to be very rational of how we bring vaccines into this country. It can't be an open door. because again, it's a vaccine on our soil that can't be used on someone else's soil.
Maria, Canada and the U.S. have both been donating vaccines to countries in need, even though we have vaccines in freezers. But why haven't these donation initiatives been more effective?
I think there's a couple of different gaps here. One of them is the difference between the number of vaccines that have been pledged to be donated and the number of vaccines that have actually been donated. There is a pretty substantial gap in between those, and a promise really doesn't cost very much. The actual donation is what is actually impactful. So we really need to look at that, the difference between what we're saying we're going to do and what we're actually going to do. But the other sort of gap in my mind is how COVAX was supposed to work and how it has functionally worked. So it was supposed to have worked by these high-income countries buying in and supporting this purchasing power of low and middle-income countries. In reality, though, we had this global vaccine shortage, and what wound up happening was that these high-income countries, the US and Canada included, decided, actually, I'm going to put myself at the front of the line. And Canada was a good example of that. Canada actually drew vaccines out of COVAX in the first round, which is really not how COVAX was designed to work. And so, we've set out these goals for ourselves, which are very nice. But we have kind of lost the plot on the way to accomplishing those goals.
Dr. Schlegel, how do we come around to the thinking that we've talked about the virus, the longer it's around, it's going to mutate. But if one country isn't fine, none of us are fine. How do we change how we approach that?
Yeah, I mean, I think Omicron is the global lesson, and we're doing a terrible job at it so far. We've invoked travel bans and escalated booster doses in countries that are not facing mortal risks from Omicron yet, and leaving the rest of the world at its baseline. So, I think we have to strengthen the World Health Organization in order to deal with this. There's work towards a global pandemic treaty so that we have integrated access to this pandemic, tools to this pandemic that are not limited to resource-rich settings. And I think for all of us, as we are getting our boosters and they're provided to us, we have to think about where the next dose goes and making sure that we advocate to our provincial and federal leaders that this is not a pandemic of Canada alone. This is a pandemic of our world.
I want to come back to that, what you just said, but I wanted to bring up another quote from that survey that I mentioned earlier. 78% of Canadians support their government accelerating plans to introduce a booster third dose of the COVID-19 vaccine for certain populations. Dr. Schlegel, you just said, when you are getting that booster, you should be thinking about, someone around the world. We're encouraging Canadians to get vaccinated and to get booster shots to get protected. How do we make sense of that from an ethical point of view?
It's tough, right? I mean, the science does support getting a third shot for certain populations. I don't think anyone denies that. There are breakthrough infections. We restore neutralizing antibodies with the third shot. I think we have to think about this more from a resource scarcity standpoint. So what if we were the country last in line? What if we were looking at people getting their booster doses before we had access to our first? What if we were healthcare workers working in an Omicron surge with only 25% of the healthcare work population vaccinated that has been described by the African WHO? And so, I think those pieces need to be there as part of our messaging around booster doses. We are privileged. We have doses. We have to use them, and so be it. But we have to think about the next dose and our long-term vaccine plan not being fully Canadian, but global.
Maria, I want to ask you that same question.
I think it's really tempting to think that if I don't get a booster, that shot could go to someone in a lower middle income country, and that's unfortunately logistically not the case. What we're the vaccines that we're using in Canada right now are not driven by demand. They're driven by supply. So, if you're eligible for a booster, you should get boosted, and you should not feel as though you're taking away a dose from someone else. But at the same time, just as Dr. Chagla said, we have to be advocating to our local and federal politicians and our policymakers to say, you know what, I don't want another vaccine because of another variant of concern that's occurred because of global vaccine inequity. And I agree that there's absolutely no circumstance where it's ethical for me to have 3 vaccine doses and a healthcare worker in a high transmission community have none.
Many public health units have advised for smaller gatherings this holiday season. I think a lot of us have been waiting to celebrate this season because last year we didn't get those opportunities. What should we keep in mind moving forward within the next few weeks? I know a lot of people are exhausted from having to make decisions and having to change plans. But as we head into this holiday season, what should people keep in mind, Dr. Chagla?
Yeah, number one, this is a point in the year where people are kind, people are reaching out, everyone is working towards, families being safe and that type of thing and enjoying the holidays. And so it is a time to bring up those first dose conversations amongst people that have not had them. And again, coming from a place of respect, but knowing that family and trusted peers can often reach people better than myself or other people in the medical profession. But number two, I think all of us need to take tabs of making sure that we get tested when we're symptomatic, that we keep the gatherings relatively small and know the consequences, and that the people that are eligible for a booster, particularly are old, vulnerable, those with medical conditions, get it. And knowing that this Christmas holiday or this next coming couple of months, we're going to see a lot of disease transmission in our community, we need to make sure that this is an opportunity that our family and friends are safe as well.
And Maria?
I think, I really agree. I couldn't agree more with the feeling that everyone is exhausted. And I really understand that, we're really done with COVID, and unfortunately, COVID's not done with us yet. So the good thing is that we're not starting from ground zero. We really have a lot of things that we've learned over the last couple of years in order to keep ourselves safe and to keep our families safe and our loved ones safe. Those include vaccination. They include high quality masks. They include physical distancing, if possible. And that may not always be possible, or it may not be just a viable option during this time of winter holidays. And then we have to think about what other slices of Swiss cheese can we add to make this building or this family as safe as possible. Testing is another really important part of that. So we really do have the tools. We do have the understanding at this point of what we can do, and we just need to follow through.
Dr. Chagla, since you're here, I can't let you go. We only have about a minute, but McMaster University will soon begin human trials for the inhaled COVID-19 vaccines. You're an associate professor there. Can you tell us a little bit about what's happening there?
Yeah, absolutely. So they're using a platform similar to AstraZeneca and Johnson & Johnson, but using it as an inhaled form. There is a mechanism here to use a conserved protein of COVID-19, so something that might not be as, dealing with the variants change around that much, and using inhalation, which is actually really cool because not only does it help needle phobic people, but using things like dry powder as the inhalational form may make international distribution a whole lot easier as well.
I think my kids will be very happy when that's available for children because they're getting their vaccine this weekend and they're very nervous about the needle. A big thank you to you both. I know you're both very busy. Thank you for helping us to make sense of what's happening right now. We appreciate your time.
It's my pleasure.
Thanks, Mary.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.